Hello, everyone. My name is Pranav Pattar, and I will be presenting on the impact of economic problems on mental health. Firstly, a little about me. I'm a rising junior at the International Academy in Michigan. My extracurriculars include student council, varsity tennis. I also founded the Science Fair Club at my school, and I tutor online and at local centers. I research, and I founded a nonprofit called Enlighten Me. In the future, I would like to do mental health research and its implications in government and policies. But today I will be talking about a topic that I'm very interested in. I'll be focusing on the economic hardships of recessions and their impact on mental health and mental health inequities. So, what is a recession? According to Forbes, a recession is a significant decline in economic activity that lasts for months or even years. This can lead, in turn, to unemployment, income decline, unmanageable debts, and other financial problems. All of these side effects are what makes recessions a catalyst for mental health issues. And mental health issues consist of a wide range of mental disorders that affect mood, thinking, and behavior. Common issues include depression, anxiety disorders, and many others. These conditions can significantly impact an individual's daily life, relationships, and overall well-being. According to the WHO, mental health accounts for 14% of global burden of disease, making it a major problem in the world today. Next, I will be talking about the effects of recessions in different countries and on the population's mental health. For instance, a study conducted in Japan found that during the Japanese economic crisis, unemployed people were twice as likely as those in the control group to be depressed. This remained true for neighboring regions as well, such as Hong Kong. Another study conducted by Reeves et al. Found an increase in suicide rates during the 2008 economic crisis, which primarily impacted developed nations. Studies saw an 8.6% increase in suicide in most European countries. The same was found in other countries, such as Canada, with a 4.5% increase, and the US with a 4.8% increase. Countries which have had an unstable economy, such as Argentina, which has sustained a fluctuating recession since the start of the 21st century, found a pattern in alcohol abuse. Alcohol abuse was higher during times of economic instability, which was primarily caused by unemployment and financial struggles that the recession brought. Economic crises have also shown to impact underprivileged communities the most, leading to an increase in mental health issues and substance abuse. With huge inequities within almost all countries and numerous studies showing lower socioeconomic background populations during economic crises led to an increased burden of economic decline. For instance, a study conducted by Hong J et al. Found that in times of economic decline, higher rates of depression, suicide, and substance abuse in underprivileged parts of cities of numerous countries such as South Korea, Malaysia, and Vietnam were found. Not only do recessions make it harder for the working class financially, these lower socioeconomic populations are also some of the ones with the least access to mental health facilities and resources. According to the World Health Organization, government expenditure on mental health is less than $1 per capita in lower and middle income countries, whereas high income countries spend more than 80 USD. Another example is the European region of the World Health Organization, which has more than 86,000 psychiatrists for a population of 840 million, while countries in the African region only have about 1,200 psychiatrists for a population of about 620 million. These populations and populations around the world face a shortage of infrastructure, facilities, and safety nets for when times are tough. This leads to an increase in mental health issues in those most affected by the economic recessions and crises. Solutions. Although solutions to these problems are very tough and require extensive infrastructure and preparation, these effects can slowly be minimized. Firstly, this problem requires policy advocacy. Advocacy for economic policies that prioritize social welfare and mental health support people during recessions. Next, we will need to enhance social welfare programs that offer financial aid, food security, and housing support to those in need. Providing international aid and support for countries going through recessions can help people tremendously. Increasing funding for mental health services will also help them make more affordable and accessible healthcare, including options such as telehealth. All of these solutions are ways to mitigate the effects of economic recession and decline. These are my references, and I'd like to thank GHLC for giving me this wonderful opportunity to present, and also my parents, which have helped me throughout my educational career. Thank you. And if you want to reach out, these are my contacts, my email, and my Instagram.